Pain narrows your world, a deep, dirty gash on your leg. You're alone, 2 days from help, and your satellite phone is broken. The silence feels like isolation. Survival depends on your next moves. Fear must give way to focus. The body can heal, but it needs your help. Stop the bleeding, clean the wound, fight infection. Simple steps can save your life. Your mind is your best tool. The clock is ticking. The journey to survival begins now. Act decisively. Your first task: stop the bleeding. A major wound can be fatal in minutes. Apply direct pressure with a clean cloth, bandana, shirt or dressing. Press firmly, using your body weight if needed. Don't lift the cloth. Peeking restarts the bleeding. If blood soaks through, add more layers. Never remove the first. If bright red blood spurts and won't stop, use a tourniquet as a last resort. Control the bleeding and you buy yourself time. Now move to the next step. With bleeding controlled, cleaning the wound is critical. Dirt and debris are breeding grounds for infection. Use the cleanest water you have, purified, bottled or boiled and cooled. Irrigate the wound thoroughly, flushing out dirt and bacteria. Use a bottle or bag to create a steady stream. Pressure helps dislodge debris. After irrigation, use sterilized tweezers to remove any remaining particles. Be meticulous. Every speck left behind is a risk. If you have antiseptic, use it now, diluted if possible. No modern supplies. Vinegar or honey can help, but clean water is your best tool. A thoroughly flushed wound is your best defense. Take your time. This step is an investment in survival. Infection is the enemy. Cleanliness is your shield. Once clean, you're ready to close the wound. Act with care and precision. With a clean, bleeding-controlled wound, should you close it? Often, yes, if you're confident it's clean. Closing protects tissue and speeds healing, but traps bacteria if not done right. Improvise with what you have. Sterilize sewing needle and thread, fishing line or dental floss. Sterilize everything, boil or flame until red hot. Stitching yourself is painful but necessary. Push the needle through one side, about 1/4 inch from the edge, then through the other. Gently pull the edges together. Don't over-tighten. Tie a square knot. Space stitches 1/2 inch apart. You're not aiming for perfection, just a functional closure. Each stitch is a step toward reclaiming your body. If you have painkillers, take them before starting. Steady hands and resolve are your allies. This is battlefield medicine. Do what you must to survive. Once closed, cover the wound. The next phase, keeping infection at bay. No suture kit? Don't despair. Other methods work. Use adhesive strips or butterfly bandages from a first aid kit. If none, make your own with duct tape. Twist the middle so it doesn't stick to the wound. Secure the ends to pull the skin together. Apply several along the wound's length. In a pinch, even large ants can be used. Let them bite across the wound, then remove the body, leaving the head as a clamp. Regardless of method, the goal is the same. Bring the wound edges together and protect from dirt. Cover with a clean dressing, gauze or cloth. Change the dressing daily or when wet. Keep the area clean and dry. Simple, improvised closures can be life-saving. Adapt and use what you have. Healing begins with a secure, protected wound. Wound closed and dressed, the fight against infection begins. Some bacteria remain. Your immune system is now on the front lines. Support your body, keep the wound clean and dry, change dressings daily, inspect for normal healing. Edges closing, mild pinkness, slight swelling. Watch for warning signs, spreading redness, pus, foul odour. Stay hydrated. Water is vital for healing. Rest as much as possible. Conserve energy. Eat if you can. Calories and protein help rebuild tissue. Nature can help. Aloe vera soothes. Yarrow fights bacteria. Willow bark eases pain. Only use plants you can identify with certainty. Your vigilance is your best defense. Infection can turn deadly fast. Monitor closely, act quickly at the first sign of trouble. Healing is a daily battle. Stay alert and proactive. Be alert for signs of serious infection. Worsening pain, spreading dark redness and heat around the wound are red flags. Pus, yellow, green or brown with a foul smell, signals a major problem. Severe swelling or red streaks up the limb mean infection is spreading. Systemic symptoms: fever, chills, weakness, nausea, headache. If these appear, the infection is no longer local. Act immediately. Reopen the wound, let it drain, and irrigate with clean water several times a day. Leaving an infected wound closed is deadly. This is a setback, but necessary for survival. Clean aggressively, keep the wound open. Your life depends on swift, decisive action. Don't hesitate, expose and fight the infection. If infection worsens, you may face sepsis, the body's life-threatening response to infection. Signs: high or low fever, rapid heart rate, fast breathing, confusion, or extreme sleepiness. Sepsis is a medical emergency. Options are limited without antibiotics. Don't give up. Support your body aggressively. Hydrate constantly, even if not thirsty. Lower fever with cool cloths. Keep the wound open and clean. Focus shifts from wound care to systemic support. Rest is essential. Conserve every bit of energy. Lie down, stay calm, breathe steadily. Your immune system is your last defense. Give your body water, rest, and a fighting chance. We've faced a life-threatening wound, alone in the wild. The steps: stop bleeding, clean, close, and fight infection are simple but demand courage and clarity. These are proven, life-saving skills, not just theory. Your hands are your first medical kit, but knowledge guides them. Gear is useless without know-how. Invest in your education, read, watch, practice. Take a wilderness first aid course. Learn to tie a tourniquet, identify medicinal plants, sterilize tools, and tie knots. Confidence comes from practice. Preparation is ongoing. Never stop learning. Survival is a mental game. Clear thinking, calm under pressure, and knowing what to do next. The will to survive is powerful, but knowledge is your map. Learn, practice, prepare. When help isn't coming, your mind is your greatest tool. Be ready.